I remember my internship so well. It's one of those profound times in your life. It's such a big deal. You're leaving medical school and now you're seeing patients and you're looking around like, you understand I don't know what I'm doing, right? And yet they let you do it anyway. So a couple of experiences that I'd like to share with you. First one, let's do a bad one. I made a mistake in my internship that cost a patient their life. And this is not the first time you're going to hear this. This happens. We had a patient who had bad COPD and heart failure, and the professor of medicine there was starting him on a new medicine. And he told me, make sure you check the potassium frequently in this patient, Mel, because this new drug, it's an ACE inhibitor, is associated with hyperkalemia. For some reason, as a busy intern, I dropped the ball and I didn't check the potassium. And I still don't remember why, because I checked the other labs for this patient. But after about a week, he had a cardiac arrest and died. And when we went back and we looked at his labs, sure enough, his potassium had been going up and up and up. And that's almost certainly why he had a cardiac arrest. It was a terrible lesson to learn. And I tell you that story because it happens to everybody. Everybody, if you go into medicine, is going to make a mistake, and you're going to be able to draw the dots between that mistake and something bad happening to the patient. It's simply something that you have to accept, and you have to forgive yourself for it, and you have to learn from it, and you have to be better because of it and more anal retentive. But you have to accept the fact that in this job, you're a human, and as humans, you will make mistakes. Try and make as few as you can. Try and be anal retentive, and make sure that you cross your I's and dot your T's. It's really important. But if you make a mistake, when you make a mistake, forgive yourself for it. We have all done it. It's just something that you have to accept. Now, later in that year, I had become more confident. It was pretty devastating, I got to tell you. I almost left medicine, but thankfully the professor of medicine was such a great guy and told me about his mistakes, and that helped me get through it. But later in that year, I became more confident, and I was on a surgical rotation, and I was the intern on the surgery rotation, and we had a really great attending and a really great residency chief who was on that group. And we used a lot of humor, and we got along very well. And it was sort of like MASH. We would, talk to the patients and tell jokes with the patients and have fun with the patients, even though many of them had serious diseases and were dying of cancer and terrible things like that. And at the end of that time, I got some letters from the patients that had been sent to the head of surgery about what an incredible group of doctors we were and how wonderful we were. We got multiple of these, both individually and to us as a group. And it reminded me that, the most important thing you can do as a doctor, whether you're an intern or you're an attending, is to be a human. And if you're a human and you use humor and you hold hands and you cry with patients and you do all of that stuff, they will love you for it. It's a profound and amazing job. And even as an intern, I was getting those letters from those patients because I was part of this team where we were being human with our patients, and they loved us for it. So don't forget your power. You are now a physician. And as a physician, you have power, and you can relate that power by being a human with humor and humility. It's an amazing, profound job that you're about to start on.